Hi, so today I wanted to talk for just a minute about comorbid, or the phrase I prefer, co-occurring conditions with autism. So there's lots of conditions that actually happen and overlap with autism at a higher prevalence rate. Some of these are things like anxiety and depression. Those are pretty common ones. Those also tend to present as an individual ages. You may see some social anxiety in young children, but usually the anxiety and depression increase kind of as the individual ages, and those just natural societal pressures come in with that. Sleep disturbances as well as sleep apnea are very common for those with autism. If you talk to any parent of a child with autism, sleep is a very challenging issue most of the time. Stomach issues, so that's everything from GI issues like acid reflux and digestion. Also, it ranges into feeding sensitivities, feeding aversions, and I specify aversion there versus pickiness. A lot of people say picky eaters. A food aversion is a lot more intense and severe is how I describe that. So individuals with autism tend to have a lot more food aversions, and that overlaps and runs into the next thing I'm going to mention is sensory processing. So there is a disorder called sensory processing disorder, and a lot of individuals with autism either have that disorder or have earmarks of that disorder as well. Some people will say you can't have both. Some people will say it's one or the other because autism naturally occurs with a lot of sensory processing challenges. That also takes me into the next one, ADHD. A lot of individuals with autism have ADHD type behaviors that are present. Some people say you can't have ADHD and autism. Some people say you can. Either way, the overlap of the behaviors and the challenges for those two disorders kind of run together. Other issues are seizures. Seizures is a very serious one, obviously, but that happens at a higher prevalence rate among those with autism. So that's something to keep in mind and watch out for, and possibly be assessed for if you have any concerns there. And there's lots and lots of issues and comorbid or co-occurring conditions that happen with autism. These are just some of the common ones that we see a lot and that I have mentioned. And all of these, there's a lot more specifics and earmarks about the individual traits that you tend to see with autism. I've just kind of run through them super fast just so you're aware that these tend to happen. As I've mentioned in other videos, obviously there can be an academic delay or an academic component there. As is one of the earmarks of the disorder, challenges with in social engagement, social attention, social communication, language delay. All of those are pretty core issues with autism, and so those, you can say they're co-occurring, but a lot of times it's pretty much that's one of the main earmarks of the disorder that you see present. Tons of research out there on all of these things and the overlap with autism. Lots of studies have been done. These are things that can be picked up on in questionnaires pretty easily with families when someone's diagnosed, or as an intake paperwork before they're diagnosed. So that's something to just keep in mind of just the prevalence of these things.